Hello, everyone, and welcome to the Munson Healthcare Virtual Press Conference. Today is Tuesday, May 25th, 2021. And as a reminder, I just want to let you know that in addition to these press conferences that Munson Healthcare has been sponsoring along with our local health agencies, we invite you to stay connected with Munson Healthcare in the following ways. The first one is through our e-newsletter that goes out bi-weekly and contains not only COVID-19 information, but additional information about Munson Healthcare and services that we're offering and information you need to know from a community health perspective. You can also follow us on social media on Facebook, LinkedIn, Instagram, Twitter, and YouTube. And as always, please visit munsonhealthcare.org for latest information, and especially invite you to check out any date and time changes to any of our services or clinics over the Memorial Day holiday. Next slide, please. So I'm excited to be here today with our local health experts who've been with us through this pandemic from the very start. So we're going to be hearing again from Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare, along with Wendy Hirschenberger from the Grand Traverse County Health Department, Lisa Peacock, who represents Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan, Dr. Jennifer Morse from District Health Department number 10, and Heidi Britton from Northwest Michigan Health Services. And my name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your moderator today. We will have a Q&A session at the end of the panelist presentations today, so I encourage you to either submit your question directly through this Zoom video conference if you're logged on to that, or through Facebook, and we'll get to as many questions at the end of the panelist presentations as time allows. Next slide, please. So it's my pleasure to welcome back Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare, to give us an update on current numbers and status of what we're seeing at Munson Healthcare. Welcome, Dr. Nefsey.
Thanks, Diane. Okay. So getting started, we continue to have a lovely trend line in our number of cases. We are currently at a 6.7% positivity rate, again, on a rolling 2-week average, which is a good spot to be. And we are currently at 192 cases per 100,000. So certainly trending in the right direction. Next slide. You can see here we are at 26 for the number of patients that we have hospitalized across the Munson Healthcare system who have COVID-19. So again, a significant decline from where we were. Still, a number of patients that are hospitalized throughout the system, but certainly better. Next slide. And here again is just the graphic representation where you can see where we are. I will point out 2 things just with this last surge. One, that we had the highest number of hospitalizations that we'd had. And you can see at the very tail end there, we're not quite to where we were pre-surge as far as the number of patients. So again, a nice decline in our numbers, but still a ways to go there to get to where we were pre-surge. Next slide. I am happy to point out that Munson Healthcare has given over 82,000 doses of vaccine, either through our mass vaccination clinics or our employed practice clinics, but also in coordination with our local health departments and our primary care providers throughout our Munson Healthcare region. Next slide. So lots of news this week from the CDC and MIOSHA and from the MDHS. So, I think it's really important that when we are looking at recommendations that are made from these different groups to remember that we also have a pandemic response plan that kind of tells us where we need to be based on what our numbers are. So we have recently moved back down to level yellow, which means that we have cases, but they are much more sporadic in number. When you look at this, you could say, well, we still have widespread community cases, but those numbers are decreasing quickly. And so we moved down to a level yellow. Next slide. Here you can see again the difference between one of the differences between this surge and the ones we've had before are the number of people we've had vaccinated. So we've reported before with our high vaccination level in our older population, we saw much younger. This is also relevant when you look at the MyVax plan from the governor's office and the Michigan Department of Health and Human Services. So we currently for the state are at 52.5% of our residents covered by vaccination. If you'll go to the next slide. This is our region, and we're at 57%. So we are the highest in the state, at least the last time I checked. And again, just to take this opportunity to give a nod to our colleagues who are on this call through the health departments as well as others. I do have to say we've worked together in a tremendous way, I think, to really benefit the community. And you see that result in this high rate of vaccination across our northern Michigan area. So that is good news for us. Next slide. So again, a lot of news coming out this week, just so that we can clarify from the Michigan Department of Health and Human Services. What they have come out to say is as of June 1st, there will no longer be capacity limits outdoors or at residential gatherings. Our indoor establishments will be at a 50% capacity. Social gatherings are now regulated by venue, so a wedding or a conference as an example, and face masks will continue to be required for non-vaccinated individuals indoors. Beginning July 1st, that will change. The broad epidemic orders will be lifted. Next slide. There are still reasons why a fully vaccinated person would still mask. Sometimes those are situations that are required by a state or local ordinance, and sometimes not. So, we do ask that people be understanding. We've talked about patience and grace before, and understanding that they may have to meet people where they are. And just as a reminder, some vaccinated people may still be masking because they are immunocompromised. And we know that having that as a clinical background may impact how well the vaccines work. Some people just aren't comfortable with it yet. They feel more comfortable wearing a mask, and that's okay. There is hesitation for unmasked people, and so people even fully vaccinated may not feel comfortable being around unmasked people who are not fully vaccinated. And again, as a reminder, we do have people in our communities that cannot yet receive the vaccine. Children would be a good example of that. And then we have other people with other medical problems that prevent them from getting vaccinated. And so there are a lot of people who feel a responsibility to remain masked around those types of people. Next slide. And again, in indoor situations, where you are exposed to people outside your immediate household, if you are not fully vaccinated, we would recommend you wear a mask. There are still stores and businesses that will require patrons to mask up. And again, if you look at both the CDC guidelines as well as the MIOSHA guidelines in healthcare settings, the new masking recommendations do not apply. We are still doing mandatory masking at all our Munson Healthcare clinical facilities. There will, again, certain workplace settings where the MIOSHA rules will remain in place. And, if you personally don't feel comfortable without a mask, even if you're fully vaccinated, it's okay to wear a mask. Next slide. So again, just remember to respect one another. People have different thresholds for their personal safety for a lot of things, and specifically for how that relates to COVID-19. So, the golden rule, you wouldn't want maybe people asking you why you are or aren't wearing a mask, and the same would go the other way around. Doing what feels comfortable. So if you are fully vaccinated, but it makes you anxious or you're hesitant to go maskless, that's okay. You do not, even with the CDC guidelines, have to put pressure on yourself, and you can mask or unmask to your comfort level. The other thing is, a lot of people's discomfort with the new rules from the CDC is that it really puts us on an honor system. that people who aren't fully vaccinated would continue to wear masks, specifically in an indoor setting. So we do, again, if you are not fully immunized or are not immunized at all, please ask you to do the right thing, and that would be continue to wear a mask indoors. And remember to carry a clean mask with you. Again, the rules will vary from store to store and industry to industry. And whereas we had masks available in a lot of places previously, that might not be the same going forward. So just, tuck a mask in an envelope or in a bag and keep it on your person or in your car. Next slide. Again, if you have questions, your primary care provider is always the best person to answer those questions for you. If you have questions either about COVID or about the vaccine itself or anything like that, if you do not have a primary care provider or want a second opinion or have any other questions that you may have, our Munson Healthcare Ask a Nurse line is also available, and the number is there on your screen.
Great. Thank you, Dr. Nefsi.
You bet.
Appreciate those updates. Good news all around, it sounds like, but really great information too about why people still may be masking. So Dr. Nefsi, we'll have you back at the end of the other panel's presentations for the Q&A panel. We already have some questions coming in for you. So.
Okay.
All right, next, it's my pleasure to welcome back Wendy Hirschenberger, the health officer for the Grand Traverse County Health Department. And just as a reminder, Wendy does not have the video capability, so we're just going to be hearing her lovely voice along with her slides. Welcome, Wendy.
Thank you. Good morning. So before I get into my slides, I just wanted to thank Dr. Nefsi for the great summary on the new masking requirements. Just for anybody listening, so if you come to Grand Traverse County Health Department, our main clinic or our vaccination sites, you will see staff wearing masks because that is considered a healthcare setting. We have about 94% of our staff that are vaccinated, so very, very high vaccination rate, but nonetheless, we are still following all the guidelines and requirements. But if we're working in our offices by ourselves, then we're likely not masking, unless of course they're unvaccinated right now. So that's where we are. We're also seeing a nice decline in the numbers, similar to what Munson is seeing as the region. So we are averaging now less than 10 cases a day, which is great. We were up as high as over 50 during the worst part of this most recent peak, and our percent positivity for Grand Traverse County is at 4.6% as of this week. So we're seeing our numbers come down nicely. So that really has allowed us to continue to focus on the vaccinations. We have shifted our primary vaccination site from the Haggerty Center at NMC to now the Cherryland Mall. That's where we were initially doing testing for quite some time. So for right now, that is our primary site for vaccinations. We were at the Haggerty Center for over 4 months, and during that time, up until now, we've given about 45,000 vaccinations through the health department clinics alone. So the new location is 1700 South Garfield. Again, it's in Cherryland Center. There's quite a bit of markings there. The hours vary, and I'll get into that. So it depends on the week, but as of right now, it is our primary site. And so we are looking to keep that, 4 to 5 days a week as a site that people can come get vaccinated. With the focus on that, we have paused testing, but we will be bringing back testing at some point. We're just settling into a new rhythm. Used to doing somewhere between, say, 700 and 900 a day. So now at this site, the max capacity a day is about 150. But we're not seeing that volume overall. So we do have a new QR code. That is, you're able to click on that, and that will show the schedule for the week. It lists the times. Right now at our clinics, we are almost always doing Pfizer and Johnson & Johnson. It's rare that we've really received very little Moderna throughout the course, so we are really focused on the Pfizer and the Johnson & Johnson. Also, if you go to gtcountycovid19.com, you will see our schedule, and then our regular health department website also has this QR code listed as well. Next slide, please. So it's really important that, we continue to get more people vaccinated, even though the volume isn't as high as it. We're still starting to see, groupings of people coming in. We are, as I said, taking walk-ins at all of our clinics. We also still have the scheduling. You can schedule immediately. So if you're more comfortable scheduling, we encourage you to do that. Otherwise, we do take walk-ins. Dr. Nefsi said there's still many that can't get the vaccine. So it's really all of us doing our role to protect ourselves and protect those around us in the community. It's the cocooning method that we usually talk about with pertussis in babies, when babies are too young to get vaccinated for flu or whooping cough, that we have people who are going to be around them get vaccinated, protect them. I don't know about you, but I've certainly noticed a lot more traffic in Traverse City and a lot more tourists. So we are encouraging people, if you've been on the fence, get vaccinated now, and then you'll be protected once we really get the major influx of those into our area. If you get the 2-dose Pfizer vaccine starting this week, you'll be fully vaccinated by the Cherry Festival. If you choose the 1-dose Johnson & Johnson, you have until mid-June really to get vaccinated to be fully protected for the Cherry Festival. And also anybody who maybe is still on the fence a bit, knowing that the masking requirements are going to be lifted statewide, if you want to make sure you protect yourself, because maybe you have friends and family who won't get vaccinated, now would be the time to proceed. So we definitely have availability, and also know that Beta has a program that will get you to the vaccine site at no charge if needed. Next slide, please. So this is our schedule for the rest of this week. Again, all 4 days at Cherryland. We are offering later clinics with a focus on trying to get some of those 12 teenagers in vaccinated, and so we do seem to be a little bit busier in the later afternoons with that. In addition to the schedule that you're seeing here, we also are doing 2nd-dose clinics at 3 of the high schools this week as well. Just to note that if you are in that 12 to 15-year age, you do have to have a parent or guardian. You have to have consent, and we prefer it if they're in person. Next slide, please. And then I just wanted to show the vaccination progress for Grand Traverse County as a whole. So for our initial dose initiation, we're almost at 65%. So that's a great number to see. And then for those who have completed, so there's always about a 2 to 3 week lag, about 3 week lag behind with the Pfizer. We're at 57.5% completion. And then the bottom chart shows the percentage vaccinated by age group. I will say that I pulled this last night, but the 12 to 15-year-old percentage is actually at 28% as of this morning. So we are continuing to see that age group wanting to come get vaccinated, which is great. And some of the other numbers have gone up as well, but we are, I would say for the age groups, we're somewhere between 7 to 10% ahead of the curve for the state average as a whole for Grand Traverse County. So continuing to see nice progress there. That's all I have for today. Thank you.
Thanks, Wendy. What a great update. It looks like things are going really well in Grand Traverse County. And just again, thank you to all the work that you and your team and all of the community partners have done to get these numbers to where they are. And thank you very much for that reminder that if we want to be vaccinated before the influx of tourists at Cherry Fest, there's still time. So that was a really great tip there. So Wendy, we'll have you back for the Q&A after we move on to some of our other speakers today. So next, I'd like to welcome back Lisa Peacock, the health officer for Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Lisa, it's always great to see you. Welcome.
Thank you. Great to see you too, Diane. Thanks for having me today. I apologize for the lawn mowing that's going on outside my office, if anyone happens to hear that. So for Health Department of Northwest Michigan and the Benzie-Leelanau District Health Department, we are seeing much of the same picture that Wendy described, with cases decreasing. Our average daily cases in the Northwest District are down to about 20 from a peak of 85. just a few weeks ago. And Benzie-Leelanau is down to less than 10 cases per day. So that's really great. We're also seeing, of course, the pandemic risk indicators decreasing as well, the cases per million per day and the positivity rates. So again, we're grateful for that change, that shift, and all of the people that are getting vaccinated as our vaccination rates increase. We are looking at, 80 to 85% of seniors that have been vaccinated across the counties of my jurisdictions. We have about 55 to 65% of the total population 12 and over, with some varying degrees across our counties, but overall doing really well. And about a third to half of teens that have now initiated their vaccination series. So we also are really glad to see that, that demand continue. We were adding lanes to our clinics last week and having lots of people taking advantage of some of the strike team opportunities that we've been bringing to the communities. So that's very encouraging that people are still really interested in getting vaccinated if they have not yet been. Our distribution strategies have really changed. We still have a standing clinic in each county across both health department jurisdictions. So people do have a standing place where they can schedule an appointment and reserve their spot and come in and get vaccinated at least once a week. But then we're taking all kinds of different strategies to try and reach those who maybe won't make an appointment and come in, but are willing to get vaccinated if we come to them. So we have been at places like festivals, food pantries, restaurants, bars, wineries, and all kinds of places in the community, gas stations. So you don't be surprised to see our vaccination teams out there in the community. Our public health nurses are always happy to answer questions, and they've been answering lots of questions, whether it's either at our clinics or at one of those outreach opportunities in the community. And sometimes that's just what people need, is the opportunity to have one more conversation, to get one more question answered, and then they can choose from Johnson & Johnson or one of the 2-dose vaccine series and be able to get vaccinated right away. So we want you to know that you can still walk into any of our clinics. We do require parent consent for minors, and we do prefer that the parent be on site with them. If that's an impossibility, we can talk about that. So just call us. We have also initiated an online form that people can use to submit their out-of-state vaccine records. They can also walk into our health department offices during our open hours between 8 and 5 for Northwest, between 8:30 and 4:30 for Benzie-Leelanau, and we will take their shot record then. But it's really important that we get those shots entered into NICR for our residents of Michigan who have been vaccinated somewhere else. We also have a mechanism at both health departments for businesses or entities in the community that would like to host a pop-up vaccination clinic. There's an online form on the Health Department of Northwest website that can be submitted where we gather a little bit of information. And at Benzie-Leelanau, they can simply email us. All of that information is available on our websites. So we've listed the websites here. You can still call 211 for assistance if needed. And I don't think I need to cover anything about the new masking changes. Both Dr. Nefsey and Wendy covered that pretty well. So I'll stop there.
Great, thank you, Lisa. And of course, I love hearing the lawnmower though, because I know the weather is warmer and we didn't have that all winter. So that's a good thing, actually. Thanks, thanks, Lisa. Great work being done in your jurisdictions as well. And again, thank you for all the hard work that you and your teams are doing. And I love the idea of these pop-up clinics, and look for them coming to a business or winery or gas station near you. So it's great. All right, Lisa, we'll have you back for the Q&A in just a minute. But next, I'd like to welcome back Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. And that's a large jurisdiction, Dr. Morse. I'm excited to hear about your progress as well.
Well, I think it probably mirrors what everyone else is talking about. We have seen decreased demand for vaccine in our clinics, so we have cut back a little bit. We do have vaccination clinics in our offices on Tuesdays and Fridays, and you can walk into those, or you can also schedule online or call as listed on the slide there. We do offer the 3 different vaccines at all of those clinics, so whichever vaccine you prefer, whether it's based on your personal preference or whichever is available to your age group, those are all available. We also have numerous different vaccination clinics out in the community in different counties. Some are at schools, focused more towards our younger individuals. some are at farmers markets or food distribution areas, different things like that. And if you have any interest in us coming to your work site or any location like that, just let us know. We're happy to work with you. We've almost hit the 100,000 mark in terms of number of total vaccines administered for our 10 counties. We're just almost there. So we continue with those efforts. Like everyone else mentioned, our numbers do continue to trend downward. You know, we're starting to have more seasonal work come into the area, and some of those situations that last year we had some outbreaks related to, but working really hard with vaccination clinics and you know, testing sites and things like that. So hopefully this year we won't see any of those concerns. So we can hopefully have our numbers continue on the downward trend. Other than that, I think pretty much everything I would have to say has already been said. And so I just encourage people again to come into our offices on Tuesdays or Fridays. Go to vaccinefinder.org and you'll be able to find many other opportunities to get vaccinated in your community. And again, if you're an organization that would like to have us visit any of your locations to offer vaccines, then give us a call. Oh, and that picture from last time, yes, we do have our mobile clinic. We have been taking that out to numerous locations. We're not really doing a lot of vaccinating within the clinic, in that little mobile clinic, but just using it as a way to carry our supplies and our people around. But that has been a great asset for us. So again, we're ready to travel wherever people need us. So I think that's all I have in terms of specific updates today.
Great, thank you, Dr. Morse. We'll have you back for the Q&A session after we hear from our final panelist of the day. Welcome back, Heidi Britton, who's the CEO of Northwest Michigan Health Services. Heidi, it's always great to see you.
Thank you. Thanks for having me this morning. Very similar to everybody else, I would like to report that as we started vaccinating back in January, we've given 4,700 vaccines. So I think we're the boutique of the group, which is small but hardy and mighty for sure. We're committed to making getting that vaccine very easy. So in order for us to do this, we're doing walk-ins are welcome, whether at one of our health centers or at one of our community pop-up events. Some of our community pop-up events are listed on our website or our Facebook. We post our weekly events in both places. So please check out our Facebook page, check out our website. It will give you the most up-to-date information as far as where we will be. And then sometimes we'll just take our medical mobile clinic and just drive it over to Olson's or drive it over to the gas station, like you were saying, and just see if there's anybody that needs a vaccine right then and there. We are no longer doing curbside testing though. At this point, we are concentrating all our efforts on the vaccine. We are, however, if you are a patient of ours or would like to become a patient of Northwest Michigan Health Services, we are doing testing for our own patients, providing medical, dental, and behavioral health services here in Traverse City and Benzie, Manistee. And we're still working with our farmers, our wineries, any other businesses for pop-up clinics. Just contact us, let us know that you're interested. And we'd happy to serve. We were at Chateau Chantel yesterday, and we'll be at Father Fred this week on Friday. Thank you.
That's great, Heidi. Glad to see all the great work that you are still doing, and thanks to you and your team for all the hard work throughout the pandemic. So, all right, well now I'm going to bring all of our panelists back for the Q&A session. And if I could just ask, because the first question is related to the Munson Healthcare's pandemic stages, if we could just bring that one slide back up that had the different levels on there. I will start the Q&A session with Dr. Nefsi, and it's really a two-part question. So Dr. Nefsi, the first part is, can you expand a little bit or explain further the move from orange to yellow, and maybe just explain what factors or what data, what information does Munson Healthcare use in order to make that determination to lower our pandemic status level? And then also, just on a related question, if we're still in yellow, that still means we're in a pandemic stage. So we're not quite out of the clear yet. So I just wanted to make that very clear to everyone as well.
Yeah, thanks, Diane. Yeah, we are definitely not in the clear yet. So I'll just say generally, every hospital has a pandemic response plan. It's not specific to COVID-19. It's, really a plan that is adaptable to any infectious disease that may cause a pandemic in our community. And so within that, the guidelines are really sort of broad guidelines based on percent positivity, kind of what we're seeing in the community, how many cases there are. And it really helps guide us on what we need to do as far as things like masking and communication and visitation policies and a lot of things that impact the care that we provide in the hospital. So it's not an exact science. It's not like once you get to X number, then you move here. It's, very fluid. And what we found is, often our percent positivity rate and our numbers per 100,000 don't always, they aren't always in the same level. So basically what this means is we are predicting, we have predictive models. We look at the cases that we have very broadly across our communities at a county level. And when we started to see those start to go down, our cases went down of how many people were hospitalized. We really said, okay, some of the things that we have in place under orange level, can be moved down to the next one. So we're still prepared. We're still aware that we're in a pandemic. We still have a lot of things in place as far as limited visitation and testing and masking and all of those kinds of things. But what we are seeing is a trendward down. That means that we can be, a little less maybe vigorous than we were at the orange level to now yellow. We are still certainly concerned about variants, but we are at the same time very positive about what we're seeing with vaccination. And so we felt pretty confident that the move to level yellow was a good one. We will continue to monitor. I mean, these, again, as I said, are quite fluid, but we will continue to monitor those and make the right decisions for us as an organization to keep not only our staff safe, but our patients safe and ensure that we are able to take care of patients as they come in.
Thank you, Dr. Nefsi. And can you also just explain the move from orange to yellow? It did impact the visitation policy. Can you just explain to everyone what the new visitation policy is? Because we do still have some restrictions, but I think we were all happy to be able to loosen those a little bit with the move to yellow.
Yeah, so roughly speaking, I would certainly direct everybody to our website for your specific situation. But basically what we're seeing with the new visitation policy is everybody can have a support person, and then certain members of the population, like pediatric patients, OB patients, can have two caregivers with them. And then at end of life, we always do make some adjustments to try to address the special needs of those kinds of situations. So that I would say, again, depending on your situation, you can look at our website. It might be slightly different in our emergency departments, as an example, but we are allowing a single adult support person for basically every patient.
And that is regardless of vaccination status.
Correct. Okay. Correct. Great. However, everybody will be required to be masked.
Yes. Yes, we are still masking. That's right. Yes. Thank you, Dr. Nefsi. All right. I'm going to have you comment on this, Dr. Nefsi, in a minute, but I would like to ask this next question from the reporter to Wendy. Wendy, you mentioned the Cherry Festival, and there's still time to get vaccinated before then, but the question is related to Memorial Day surge. Are we at all concerned or anxious, or are we anticipating another surge based on Memorial Day travel?
That is a great question. And whether or not we will see the surge here or the surge will be realized actually once they return home might be the question. But I would say when you're out and about right now, you definitely can tell there's a definite influx in our region of visitors, people who've come home for the summer, and people out and about. So the good thing about summer and Memorial Day is most of the activities that people are doing are outside. So if people are still being careful around those who are unvaccinated and planning the majority of their activities outside, then hopefully we will not see a surge. That combined with our high vaccination rates, it'll be a little bit of a test for us. So for right now, for me as an epidemiologist, between now and July 1st, it'll be interesting to see what happens with our numbers. We're truly hoping they stay stable and low. But we will be to some degree learning as we go, and seeing how everybody handles some of the freedoms we're going to have again.
Thanks, Wendy. I'm going to ask Lisa to also comment on that, just from your district's perspectives, and maybe additional, community festivals or the influx of tourism that you may be encountering as well.
Mhm. Yeah, and I agree with everything Wendy said. I would just add that it really is different this year from last year because of the vaccine, and the vaccination coverage levels that we've been able to achieve so far are really encouraging. And so, I think this year when we're looking at festivals, instead of figuring out how not to have them, we are looking at how can we be there and get more people vaccinated. And so, I think it is just a different time. And I also am hopeful that people will do the right thing, and especially those who have not been able to be vaccinated or have chosen not to get vaccinated, and continue to be careful. But I am very hopeful that this year will be better.
Thanks, Lisa. Dr. Morse, any other comments from your perspective?
I had read an interesting article just talking about kind of the perspective of it. If we're vaccinated, really we are essentially safe. Nothing's 100%, but we are essentially safe. And so those who are unvaccinated really just need to protect themselves from themselves and from others. And so it's maybe uncomfortable for some of us, but we just have to rely on adult behavior and hope that those that are unvaccinated choose to wear their mask to help protect themselves and help them protect others like themselves who are unvaccinated. But those of us who are fully vaccinated can feel comfortable in our protection status. Hopefully I explained that well enough. But for those who may feel unsafe still and are not yet vaccinated, you really do need to strongly consider your choices and consider getting vaccinated to have that safety.
Thanks, Dr. Morse. And Heidi, from your perspective, any words on anticipation of another surge, either from Memorial Day or from influx of tourism?
From our perspective, I rely on the health departments for that, and I love all their words of wisdom, and I would just echo that. We're just looking forward to having patients back in the clinic, having patients feeling comfortable coming back into medical offices and dental offices and behavioral health therapy, and doing it carefully and safely, and just celebrating the lovely weather that we're having here in Traverse City.
Very well said, Heidi. Thank you. Dr. Nefsi, this question is for you. It's from one of our reporters, and you are also a trained pediatrician. So the question is related to children. How do we know that the vaccine won't cause problems for our kids years down the road?
Well, it's like a lot of things, as a little bit as we learn as we go, but I think it's really important to remember a couple of things. One is these vaccines have been studied extensively, and for quite a while. They are not new. The technology is not new. And we are, as you could see, I think with some things that have happened, looking very, very closely at both the efficacy and the safety of these. What we know historically is that typically with vaccines, if you're going to have long-term effects, it's within the first 8 weeks of the vaccine. I think it's important to understand we've already had like 4 million people under 17 get this vaccine in this country already. So the likelihood of that is low. I feel confident that these vaccines are safe as well as effective for our kids. I think the other thing to remember is what we're seeing both short-term and long-term for the kids who are actually getting COVID-19 with this latest surge, and we had many, many more children be infected with this, I think some complacency that we may have seen earlier that, oh, kids don't really get it, they're fine, really has been removed. We've had like 3.6 million kids in the United States get COVID-19, and about 15,000 of them have been hospitalized. And some of those that are getting hospitalized are very, very ill. So, the long-term complications, not only of a hospitalization, but what we're seeing with adults and children with the long hauler syndrome, there's a lot of unknowns with that. So I think the risk of long-term COVID for me far outweighs any potential risk for the vaccine.
Thank you, Dr. Nefsey. Great answer. This next question is from a reporter. It is not directed at anyone in particular, so maybe I'll start with Lisa for this one. How concerned are you that the revisions to the state's reopening plan don't incentivize vaccination anymore? Because as Dr. Nefsey mentioned, some of it's tied to dates now and maybe not vaccination rates. Do you have any concerns about that, or?
Uncertainty and the unknown of the future is always a little bit concerning. And so a lot this year, I think it would not be normal for us not to feel at least a little apprehensive about what will happen as we move forward. However, we do know that strict mitigation measures are not the way that we were meant to live in the long term. And so it's difficult. It's very difficult, and nobody will deny that. And so, I think this evolution that we are moving through in the month of June toward July 1st, where broad orders will be lifted, is a good thing in general. And it doesn't mean that public health recommendations go away. It doesn't mean that guidance goes away. It doesn't mean that we won't have to be cautious, but we're moving back to more of a normal time where public health makes recommendations to control communicable diseases. And we hope that the public trusts those recommendations and follows them. There will still be recommendations, and there will likely still be orders designed to protect vulnerable groups. I'm sure the hospitals and nursing homes will still have rules that they will need to follow to protect those vulnerable patients. And so, I think it's an evolution to a different time, and I'm excited about being part of making it work. So.
That's very well said, Lisa. Thank you for that answer. Dr. Nefsey, this next question is for you, again, from one of our reporters watching. Are you seeing a lot of patients who have had COVID-19 in the past now coming in with other related medical issues? And I guess, maybe we're terming them the long haulers.
Yeah, it's a great question. And I think that's one of those things that we are continuing to learn more and more about. Certainly, there have been quite a few studies done that are, granted, relatively preliminary because we're only 18 months into this, but there are quite a few studies that show a higher percentage of people who have had COVID-19 naturally coming in with issues later. I think it really remains to be seen. Certainly, we are hearing from some of our primary care providers that they're seeing patients come in who just, can't kick it, or however you want to say it. They've got symptoms and they can't explain them another way. So I think that that's something that we will definitely be learning more about as we move forward with in time. But certainly, we are hearing reports of that.
Thanks, Dr. Nefsey. This next question is for Wendy, just a general question about moving the vaccination site from Hagerty to Cherryland Center. I know there's a lot of logistics and planning that goes into these, setting up these clinics and that, but could you just maybe explain why the sites are kind of moving around?
Sure. So we never intended to stay at the Hagerty Center. Initially, our goal was to be out by the end of April, but there was still high demand and high volume. So NMC graciously allowed us to stay at the Hagerty Center longer. But as higher numbers of the population got vaccinated and the demand started to decrease, and some of the restrictions started being lifted. Obviously, NMC's Hagerty Center has other purposes and uses. There's some construction going on as well too. So we're just in that transitioning phase, and we actually transitioned out probably 4 to 6 weeks later than we anticipated. We have had a lease at the Cherryland Center for I want to say maybe it's been a year, with us doing testing out of there primarily, but also the plan all along was that we would eventually transition to doing vaccinations and testing. So that's what we're in the middle of now.
Great, thanks, Wendy. And one more question for you. This is specifically directed to Grand Traverse County in your area. What's contributing to being ahead of the curve on your vaccination rates, especially for the teens in your area? You had that really great slide that showed how well you're doing on your numbers of teenagers being vaccinated.
I would say for our county as a whole, it's the collective impact of all the different people vaccinating. I know Heidi mentioned that they're the boutique of the group, but a good way that I think about it as, you know, maybe the hospitals and the health departments had the bulk of the initial vaccination, so we're like the tile floor, but Heidi's group and some others are like the grout, and you don't have a solid floor unless you have both in combination. So to me, at this point, the numbers aren't as important as much as we're starting to see the coverage continue and even getting to some of those pockets of the harder to reach groups. And sometimes that takes just as much work and effort to do 4,500 as it does 45,000. So to me, it's the collective impact of all of us working together. And I will say that, you know, Dr. Nefsey said, we have been working together this entire time, meeting every week with our local health departments in the hospital. And I think that's a huge reason for our whole region as a whole being higher than the rest of the state is we're continuously ensuring that we never had to cancel vaccination clinics, that everybody has the vaccine we need. And, you know, we're not competing, we're working together. So I think that's, and I'll say as far as the teenage group, we definitely wanted to focus on high schools and middle schools. I know Heidi's group has gone out and helped with the middle schools as well. Similar for other local health departments, we've all made concerted efforts to really try and get the school age kids vaccinated before the end of the school year as much as we could, to reduce the quarantines in the schools. We all have school-based health programs as well, so we understand the importance of kids staying in school. And as a region, I think throughout the entire pandemic, we really had kids attending school much more than other parts of the state. And I think that's an impetus for this that we've heard from some of the 12 to 15-year-olds too, is that they wanted to be near their friends, so they're getting vaccinated so they don't have to be quarantined. So that has just been great. A lot of the kids have really stepped up, and you know, one in particular wanted to be the first, and then he recruited the whole rest of his baseball team to get vaccinated so that they can continue to play together. And so that's how vaccinations work as a whole. So it's been great to see.
That's great, Wendy. And Heidi, any additional comments on that? Are you going to continue some concerted efforts around vaccinating younger populations?
Yeah, like Wendy said, we've worked with them. We went ahead and did here the middle schools here in Traverse City. We talked with Lisa about working in those counties. We did the Manistee area public schools and that. So really focused on where kids are at. Going back for the second doses before school gets out, which is fantastic. There's so many families that are ready to take a vacation right when school is out. And so the timing was actually perfect as far as getting it in that first 2 weeks. And that was the priority, I feel like, from everyone on the panel, to offer it as quickly as possible. They shared the Pfizer with us, and we stood up just as fast as we could. I think it's remarkable. I think the kids have been waiting. I think that they're excited to not have to test anymore. I think they're excited to not wear, I mean, you know, personally, my kid was like, this is when I don't have to wear a mask anymore, right? I mean, they're just excited, and they've been so resilient this entire year. It is amazingly awesome how much our kiddos have been able to go to school and how much work the health department's been doing to like, just make sure that we're all together. We got this vaccine out. I think it's a huge success for our area for sure. So really excited to be a part of it. And I love being the grout. Thank you, Wendy.
I love that term. It's awesome. Thank you, Heidi. And just one last question. I know we're a little over time, but I'm just going to pose one last question to Dr. Morse. We've talked a lot about the younger population being vaccinated at 12 to 15-year age. Are they being counted in the numbers when we talk about percentage rates for, because I don't think they were at one point, but has anything changed with that?
When the VAC to normal plan was going, they were not included in that. It was just the 16 and above group. Now that that's gone, I mean, I don't know what numbers we're following, but I know for the VAC to normal plan, it was just 16 and up. So
Dr. Nefsi, do you have any insight into that?
This is Wendy, and I can answer it if you'd like.
Sure.
Sorry.
Absolutely. Go ahead, Wendy.
Because I kind of live in those statistics. So if you go to the state vaccine page where you see the charts and some of the charts that I showed, you can add in, it defaults to all the age groups, so it's the 12 plus, but then you can also select. But they did add them into the denominator, and that's why you saw 1 week the numbers actually went down. They went down because the denominator got bigger, and then we hadn't started the 12 to 15-year-olds, but they are now included in there. They just weren't part of that vac to whatever plan. Sorry, forgot the name.
All right, great. Thanks, everyone. Those are all the questions we had for today. I want to just remind everyone who's still watching about our community resources. So again, that 211 Michigan number is still active. There's the Area Agency on Aging for Northwest Michigan, in addition to all the contact information for the panelists we had on today. This information is available on the munsonhealthcare.org website as well as all of the health department websites. So if you still want to get vaccinated, there is still plenty of opportunity out there as we continue to try to get the word out. And just as a reminder, again, please connect with us through our e-newsletter on social media and visit munsonhealthcare.org for the latest updates. So again, thank you to Dr. Nefsi, Dr. Morse, Heidi, Lisa, and Wendy. It's always great to hear from you. We are not planning to have another virtual press conference next week. We will be looking at our numbers and looking at the information we need to share to determine if we'll have another one in a couple of weeks here and invite these guests back. But in the meantime, I hope you have a safe Memorial Day holiday. Enjoy, hopefully have some great weather. And again, thank you to all of our partners for all of our collaboration and hard work, and have a great afternoon, everyone.